So international superstar, leader in his field, and one-to-one is basically the big points of this hospital. Hi, my name is Han, and I got the Clear Lasik here at Eyeonce, and I had a really good experience. So we're just gonna ask the doctor a couple of questions now. So, do I have to wear glasses only before the surgery, or how long should I go without my contact lenses?
Before the surgery, right?
Yes.
Okay. Actually, it's okay to wear the glasses even the day before surgery. But we have to check out your eyes if there's no inflammation or other problems with the contact lenses. So safely, we recommend to take out about 3 to 5 days before surgery. That even though if you carry lenses and eye drops during the day, usually days, and we check there's no problem, it's okay even you wear it before the surgery.
The contact lenses or glasses?
Both glasses
Both?
and contact lenses. Also.
Okay. And what's the difference between traditional LASIK and clear LASIK?
Okay, the biggest difference is the amount of the incision site. Okay, the traditional LASIK, we make an incision about 20 millimeter, and clear LASIK just 2 millimeters, 10 times different. So if you make more incision, there's a risk of like flap injury if you lob your eyes and if you get hurt or injury. But just 2 millimeters, the injury never happens. And when we make more incision, maybe the possibility of dry eye will be much better, much more. So the biggest difference is the incision site. And with the LASIK, we make the flap with the femtosecond laser, and we correct the eye vision with the excimer laser, 2 different laser. And with the clear LASIK, we just use 1 femtosecond laser, so less hurt in your skin.
So you think that traditional LASIK is more invasive than clear LASIK?
That's right.
Okay.
But it's still very safe and good method. But clear LASIK is more better technology and latest technology.
Would you recommend clear LASIK for people with astigmatisms more than traditional LASIK?
That's right, because with the clear LASIK, we can correct the astigmatism more accurately. By the monitor, we can change the axis of the astigmatism. That's why we can make more good result of the correction of the astigmatism. Like you.
Yes, have a very bad astigmatism, or I had before. Very big problem. Is it possible to get a vision correction surgery on the day of visiting? And are there a lot of things to check before surgery?
Yes, of course you can have the surgery right away on the day visiting day, but unless we have to check your eyes first, right? If there's no problem, it's okay. And we check many things about the eyes, like thickness, shape, and many things about the eyes, the nerves, the vessels. If it's all okay, we'll go on. But we check many things about your eyes because you have to be safe and you have to be accurate. So you don't really worry about the examination evaluation.
What are some things that would prevent you from having surgery on the same day? Like extremely dry eyes or some kind of complication?
Extremely dry eyes, we take time. We take time and cure the dry eye first. And like even if you wear the contact lenses and there's many scratches and some problems with the eyes, then we have time to cure first about the cornea. Then we go over to the surgery. So it depends on your eye condition, the surgery day.
Are there any specific age restrictions for LASIK or clear LASIK?
In the textbook, they recommend the refractive surgery over 18 years old. Above, no restriction.
Gotcha.
If it's over 18 years old, you're free to do it.
Even if you're like 70 years old?
Sure, yes. But sometimes you do it.
Oh, really?
Yes, because even they have like cataract surgery, even they don't. They just want to see better, and we can correct the error of the refractive with the refractive surgery lasers. So sometimes I do to 70 years and 80 years old.
Maybe I should tell my mom. Is it possible for somebody with really bad eyesight?
Yes, possible, because actually there's many kinds of refractive surgery or eye surgery to make your refractive errors better. So first we have to check your eyes, which one is right for you. But even you have very bad eyesight, there are many methods and we can heal them.
Okay. Is it possible for someone with severe astigmatism?
Like you, right?
Yes.
Sure.
The answer?
Yes. But she's the answer.
Yes.
Possible.
Yes. I'm living proof that it
Yes.
works.
But the severity of the astigmatism must be checked,
Mm-hmm.
and we have to recommend you which one is better to correct it.
Mm-hmm.
For you, it was Clear Lasik.
Mhm.
Maybe for someone, it could be some other things.
Will there be any dryness or halos or starbursts after the surgery?
Yes, because after surgery, the recovery times takes about 3 to 6 months for everyone, like even you. So these days, they will feel dry eyes more than usually, and the nerves will be recover after about 6 months to 1 year later. So dry eyes will be happened, but it depends on person to person. So there's many good medicines, and you can care with that. Then maybe you can feel much better even you have a dry eyes after surgery.
Say somebody had LASIK maybe 5 or 10 years ago. Are they able to get clear LASIK now?
Sure, they can. I have many experience with that too. But it's also depend on your the evaluation eye exam, because you need to have much more thickness about that, and you have to have regular shape of the cornea. If that's all okay, then we can go over with the Clear Lasik. But that's not enough. We have to think about other methods.
After the surgery, when can people start to wear things like color lenses?
That's many questions I get from the patients.
Yeah, especially in Korea, it's very, very popular
Yes.
to wear like
The
blue
color
or
lenses,
green or
that's right.
cosmetic. Yeah.
Yes. For me, I recommend after 3 months, because the most healing period is 3 months. But it also depends on the people. Sometimes I say after 1 month, I think you can wear it from now. But sometimes I say, I think you need to wear about 6 months later. So it depends on people. But usually recommend about after 3 months, and that's possible to wear the color lens.
Personally, I would wait maybe 6 months just from my own perspective because I'm too paranoid that anything
That's
would
right.
happen.
If you
but-
usually have very dry eyes,
Yeah.
then I recommend more later.
Can people still get clear LASIK when they have very high eye pressure?
It depends on why the high eye pressure is on your eye. But everything is not, even every high eye pressure is not a problem. Sometimes high eye pressure could be happen to you even if you have like very high thickness of the cornea. So it depends on if there's a disease or not. So it's not the only reason the high eye pressure can do the surgery. You just check up. If there's no problem, it's okay to go on.
And what factors are important when choosing a hospital to do clear LASIK?
Clear Lasik, refractive surgery. I think first thing is you have to check if the hospital can do all kinds of refractive surgery, like LASIK, Clear Lasik, or lens implantation. If all kinds of surgery is possible, they will recommend you the right one for you, right? But if just some kind of refractive surgery is possible, then they will just say that one is the best, and try to make you to do that, right?
To get the money, right?
Yeah. So actually, I think first thing is like you have to check on if all kinds of possible surgery is done there. So our hospital can do everything. And second is every doctor have like specialty of their major. So you have to check like if the major is like vision correction and surgery, cataract surgery, like so maybe that is one another point to choose.
And what makes Eyeonce very unique and special, and why do you recommend it to the viewers?
I have to show out myself, right?
Yes.
This time.
Just this is your bragging point.
Okay,
This is where you flex your muscles.
Okay. First, the specialty. I majored. I have a specialty of the vision correction and cataract surgery. So I only do this kind of surgery more than 10 years. So I have many experience with that. And currently, I'm working as a reference doctor in Clear Lasik. So in all over the world. So I do the Clear Lasik. I communicate with the leaders in this field. I share my resource and make a more better resource for the patient. So for the Clear Lasik, I think I have many experience and maybe most experience in Korea with this Clear Lasik treatment. And second, in Eyeonce, our hospital, the initial evaluation, consultation, and surgery is done by just one doctor you saw the first time. So everything is done by one-to-one. In big hospitals, sometimes like always the doctors changes, like consultation with other doctors.
That's
and
not very good.
Surgery with other doctors, like sometimes if you go to the big hospital. But in Eyeonce, we do just one-to-one. You see the first doctor, he will do the surgery, everything.
So consistency.
Yeah, that's right. Yes.
So international superstar, leader in his field, and one-to-one is basically the big points of this hospital. And we all know that Clear Lasik is a cutting-edge procedure, but how did you get started in this field specifically?
Clear Lasik, right?
Yeah.
It started about 1 to 2 years ago. Clear Lasik. Actually, most people, for example, like to use the latest technology, like a cellular phone or computer, everything, right? Doctors also want to use the latest technology equipment, and I'm also one of them. But to use the new technology, they have to have a challenging, and they have need skills, right? So that all the goal for that is to make the patients good refractive results. That's why I do my challenge on the new equipment, and I try to make it much better results. So I never hesitated to take the new technology and do it. So now I'm giving my patients who got surgery from me very good results. So I will challenge you again and again to give you the best results who come to me.
Great. And lastly, would you recommend it to foreigners who come to Korea?
Sure.
Great.
Because many foreigners come to me and later, even like in Asia, people, United States, USA, Europe, because the healing process is really fast. Total healing, it takes 3 to 6 months, but right away healing takes very fast, just 1 to 2 weeks. So if you come to Korea and visit me and take a surgery, you can go back to your country right away. Just eye drops, keep eye drops too. So fast healing will be with the Clear Lasik as possible. So don't hesitate to come.
Great.
Check out eyeonceclinic.com after watching this video for more information.